Jesus, thank you so much. Good morning, ladies and gentlemen in the room, and I suppose good morning, good afternoon, and good evening to everybody that is watching online as well. So for those of you who don't know me, I'm Chris Lynch. I'm the Deputy CEO at ADI and also the Director of Policy. A quick announcement, if I can, for a programme change. If anybody is going to the Novo Nordisk session this afternoon, in the programme, it's now in the long room, so it's different to the room in your programme. So today I am going to talk about awareness raising before I hand on to my great colleagues here. I know you are at an ADI conference, but this slide is actually quite relevant for my presentation today as well. So for those of you that are unaware, ADI has 105 member associations, 105 countries around the world, and we've got 20 in our development program as well. And it's that scope and scale that I want to tie into the relevance of my presentation this morning. So we're in official relations with the WHO, and you'll also know us for the promoters of World Alzheimer Month, and of course, the World Alzheimer Reports as well. So why is awareness raising so important? Normally, if I was doing this type of presentation, this would be my next slide, and I have kept it as my next slide, but I'll explain that. Awareness raising is needed for so many different reasons, but when you see these types of headlines, you know that every 3 seconds somebody develops dementia. You look at the new global figures that WHO published last year, and we're looking at numbers by 2050 of 139 million people. And then you look at the costs, which obviously the economists and the governments will look at, rising from an annual figure of 1.3 trillion up to 2.8 trillion. It's absolutely phenomenal. Let me just go back a second. So why is awareness raising so important? Yes, for those reasons. However, for multiple other reasons as well. I want to share something with you this morning, which I suppose is quite emotional, and it's one of the primary reasons that I do this job. Because when I first read this quote, and when I first got this case study in 2019, when we were looking at attitude to dementia, it really stopped me in my tracks. And I have to thank Rosa from our Mexico Association, who I spoke to last night about using this slide again. Let me put it up on the screen. I will read it to you as well. So, after about 10 days, I made the decision that I was going to take my husband, who has dementia, to the federal highway. I was going to throw myself under the wheels of a trailer, the biggest one I saw pass by, together with my husband, because I was not going to be able to bear everything that was coming. I woke up that day very early with my decision taken to clean the house, to leave everything ready so that they could hold vigil over us afterwards. I still struggle with that. We really were in a dilemma of whether to include it in the World Alzheimer Report, and we did. And I'm really glad we did, because it raises such an important question, stigma. One of the other major reasons that awareness raising is so important for us. Helen Rochford-Brennan yesterday in her address talked about stigma and the nuance of stigma sometimes, and even the use of the words like dementia, and that the debate around that is still going on. But it made me think, a couple of years ago, Paola and I were traveling, and we went to see Serge Gauthier and Claire Webster at McGill in Montreal. And I'd set up a TV interview for Paola on French-Canadian TV. We'd done our preparation, and 2 minutes before she was due to go live, they asked us not to use the word dementia or démence because of the stigma associated with it in that particular region. And we panicked. You know, what are we supposed to do? All of our slides, all of our information has this. And then we decided just to push through it. And I think that's something we need to really keep in mind. It doesn't really matter what the phraseology ends up being. It will have stigma attached to it. And through awareness raising, we need to push through that. So let me talk a little bit about that 2019 report, Attitude to Dementia. And a big thank you again, because I know a lot of people in the room and those watching helped us with the survey associated with this World Report. 70,000 people took part in this survey on attitude to dementia. And let me remind you of a few of the headlines that came out of this. These were absolutely incredible. So 1 in 4 people still think there is nothing that can be done about dementia. And 46% of people living with dementia and the carers identified fear of diagnosis and stigma as a barrier to diagnosis. And 62% of healthcare professionals thought that it, or still believed wrongly, that it was a natural part of aging. For me, when you look across there, you're looking at societal stigma, you're looking at self-stigma for people with dementia and for carers, and then you're looking at healthcare practitioner stigma as well. Made me wonder why dementia awareness raising is the number 2 action area of the Global Action Plan on Dementia from World Health Organization. It comes immediately after the creation of a national dementia plan, and that's why it's still so important. So what can we do about poor awareness and stigma? How can we measure societal change? And how do we measure the impact and effectiveness? So we have an amazing vehicle already. There are so many different ways to do this, but once a year, World Alzheimer month of September, is our primary vehicle for this all across the world. This always puts a smile on my face, lighting up monuments all over the world, highly recognizable. It takes a lot of planning. If you're going to do this, please start thinking about it well in advance. But in one simple gesture, it gets people talking. Measuring what we do and evaluating what we do in terms of awareness is really going to help us build from that. That World Report was our baseline, 70,000 baseline, and we're going to build from that. But just look in terms of the participating countries in World Alzheimer's Month over the last few years. It's now 10 years old. But from 2017, from 50 countries, 111 countries last year. And we sat in the office and thought, wasn't that great? And then I thought, no, it wasn't, because there's 215 countries in the world. That's up for debate, depending on geographic, political territories and things like that. But there's still 215 countries in the world. Same for this, in terms of our online measurement of impressions and engagement with the campaign and with the hashtags of the campaign. 2018, 800,000. 2021, 45 million. Pretty proud of it. However, if you think there are 55 million people at the moment in the world with dementia, and surrounding those people, there must be at least 10 other people, friends, family, colleagues, support people. That's 450 million people that we really should be engaging in campaigns and to get them to at a scale that we really do need. So one of the things we work on at ADI is a toolkit every year for World Alzheimer's Month. These are going to be coming out for this year in a week or two's time, and Lewis and Taylor and the team are working on those. But within these toolkits, you see a plethora of support materials. And that includes things like how to put on events, even during COVID, how to put on online events, as well as media advice, how to set up broadcast TV interviews, how to do radio interviews, who to invite to those, how to support people with dementia through those types of things. And of course, it also contains all of the things you're probably becoming familiar with, like the posters and the social media assets. These are some examples from 2021, when we started working with the No Dementia, No Alzheimer's campaign. We initially produced them in 4 key languages, and then our associations right across the world translate them. It's an absolutely fantastic thing to see them coming in every language. Additional assets that go into those, things that get people talking. And I think, bizarrely, talking about dementia is the entry point for most people. So the warning signs of dementia translate really well into visuals, into graphics. And that concern, it's often the most difficult conversation anyone's ever going to have. Let's talk about dementia. But this helps, it gets it going. And then we did the same. I'm not sure if Jill's in the audience, but Jill Livingston and the Lancet paper on risk reduction. We've also converted those into infographics as well that can be used. Again, let's get the conversation going. And then Taylor in the team last year has started this amazing animation of the warning signs. And we'll continue to put these out as well. And then, of course, everybody around the world started to translate them. So these are on social media, and the visual animated, and they really do grab attention. During September, at the beginning of the month, it's great. It's the start of World Alzheimer's Month, and we can generate media attention globally. And we work with a lot of the associations to do that. But then on the 21st, World Alzheimer's Day, launch of World Alzheimer's Report has become synonymous with that day. And we've now been doing this for over a decade. It again generates a really incredible opportunity to add more information and get media attention, but also get government attention and get policymakers' attention. So let me just remind you of a couple from last year. So the report, I think you'll remember last year, was on diagnosis. So globally, we estimate 75% of people with dementia are not diagnosed. It's 41 million people at the moment. It's incredible when you see that in a visual on social media or in the media. And the one next to it, again, we borrowed this kind of tsunami phraseology. But last year, when you looked at that combination of an globally aging populations, the impact of COVID, and then this emerging treatments and diagnostics is creating this tsunami of demand for healthcare systems. And for us, that's also an incredibly important message, not necessarily for the media, more so for the governments and for the healthcare systems. Collaborating and collaborative work as part of World Alzheimer's Month is becoming more and more important to us, and I really wanted to put these up again. So we've been working with WHO regional offices all over the world, but the Pan American Health Organization have been super to work with. We've got a really good relationship. So we did this campaign with them in 2019, but the reason I wanted to show it to you is actually more about this. So what came out of that awareness-raising campaign was this migration into policy and advocacy work. What happened when it worked, it didn't work well everywhere, but where it did work, you had this strong triangular relationship developing. So the association working with the country office from WHO and then with the Ministry of Health. And those relationships have persisted. The teams have got to know each other, and the awareness raising and advocacy work that they're now doing is growing and growing. And we're going to revisit that with them as well. But in terms of a policy direction coming out of awareness raising, that's one of the most important things that you can work towards. So it takes me back to this slide, Action Area 2 of the WHO's Global Action Plan. Dr. Taurun Dua from WHO mentioned this yesterday when she spoke. This is one of the only targets that is a 100% target. So 100% of countries to have at least one awareness-raising campaign. Now that feels like it should be quite achievable, but there is a dilemma with it. And the dilemma being, at the moment, we measure that there are only 40 countries in the world with a national dementia plan, and within that national dementia plan is the awareness-raising campaign. So Paolo also told you yesterday about this What's Your Plan campaign that we have going, and we're working with these 40 countries that you see on the slide at the moment, and we will keep adding to that. But we need to get to that point where more plans are coming through. But what I'm going to suggest to you is the awareness-raising campaign is the door to that plan. For governments, it's actually probably, I'm not going to say the easiest thing to do, but it's probably the thing that they can approach first, because some of the other areas perhaps are going to be daunting for them. So let me jump forward to 2022, just a couple of months' time. The theme for this year's campaign is based again on the World Alzheimer Report, these companion reports, last year diagnosis, this year post-diagnosis support. I see Claire in the audience from McGill. It's going to be a big report because post-diagnosis is a huge area. However, what worries us about that is that from last year we know 75% of people globally are not diagnosed. So how are they going to access post-diagnostic support if they're not diagnosed? So these two things have to gel together completely. And effectively, what are we trying to do with awareness raising, with World Alzheimer's Month, us as a community? And it's about this, creating this movement that will facilitate change. So I've got a couple of requests for you today, calls to action, I suppose. Decide to get involved in this year's World Alzheimer's Month. It is only a few months away. Then speak with your association, and with the association, get in touch with the government and ask them to use World Alzheimer's Month as their opportunity to tick that box with WHO and say, we have actioned this Action Area 2 of the global plan. They'll probably say to you 2022 is too soon, but get them on the hook for 2023. Get that conversation going them already. Let them know that the actual month and the campaign is the vehicle that they can use for it. And then work collaboratively. You know, turn up the volume, amplify it. And the evaluation bit, measure it, track it. So, taking us right back to the very beginning, societal attitude to dementia. We're looking at 2 years' time, this report from 2019 will be 5 years old. I think at that point we need to go back and re-ask those 70,000 people that took part, and more people, and see if there is a societal attitudinal change to dementia, I genuinely hope we will see some progress, but with not being naive enough to know that it is such a major barrier still for us. So I'm about to hand over to two colleagues and great friends, and I think Jesus may introduce them, but Professor Elaine Mateus and Miss Edna Williams from Brazil and the British Virgin Islands. I have one final thank you, but also linked very much into the World Alzheimer reports, and Chloe is sitting in the front here staring at me saying, please don't forget to mention this. Please do this year's survey. It'd be really important, and please do help us circulate it. The QR codes are around the building, or ask a member of staff as well. So look, thank you so much for your time, and I'm looking forward to the Q&A.